So now coming to the diagnosis starts from the history. Okay, so you need to take a proper history, including the travel history, what type of prophylactic drugs they took before or after coming from that particular travel, how many times did they travel, and what type of medication the patient took previously. Was there a previous history of malaria in that same patient? All these things is very, very, very important. Okay, and the clinical signs and symptoms, which we said now, and the microscopic examination of a good thick and thin blood smears. Okay, why I am mentioning about this blood smears? Because there are three major questions need to be answered by the blood smear. So what are those questions? In the blood smear, is there evidence of malaria? If there is an evidence of malaria, what is the parasite density? Because more denser or more parasite, the worse is the prognosis. Okay, and if at all there is an parasitemia, what species of malaria is responsible for the infection? Because in particular we are worried about, is it a falciparum malaria or a non-falciparum malaria? So these are the three questions you need to ask your lab when you send for thin or thick smears. Okay, so clues in diagnosis of falciparum infection is that, because we are worried about falciparum because it's very, very deadly, and even if you treat, the patient is going to die, and the chance of death is around 30% if at all the patient has already reached a severe stage, right? So what are the clues in diagnosis of falciparum infection? Presence of small ring forms with double chromatic dot within the erythrocyte, number one. Second, multiple infected rings, because the parasite index is going to be very, very high, and very, very minimal paucity of mature trophozoites or schizones on the smear. That's because of sequestration, right? Gametophytes may be seen in falciparum infection, and this is actually diagnostic crescent shape or banana shaped. Okay, and the parasitic density above 4% of erythrocytes are rare in other forms of malaria than the falciparum malaria. So if the index turns to be 4, the parasitic density turns to be more than 4%, then indirectly tells you that you are handling falciparum malaria, because the infection rate or the density rate is going to be extremely high in falciparum. Okay, so obtain smears daily to assess the efficiency of your drug treatment. Once you start the treatment, this particular density has to come down gradually. Okay, so this is the banana shaped gametocyte of falciparum malaria. Okay, can you see the banana shaped gametocyte? So when this is there, then indirectly that gives you a clue that this is falciparum malaria. So that's for the, now coming to the thick blood film. So place a small drop of blood in a microscopic slide, spread it evenly to a diameter of approximately 1 centimeter, allow it to dry, then stain without initial fixation with the Gemsa or the field stain. So now record the number of parasites seen per oil emulsion field. Okay, or other way around is, you can count totally of 200 white cells, and among the 200 white cells within that field, how many parasites are found. So when you know for every 200 white cells, if there are X amount of parasites, then if you know the WBC count of that particular individual, then you can easily calculate how many parasites this patient might have, right? So this is one way to know what is the parasitic density of that particular individual. And basically it's a lysed sample. We are using it to count the parasite. That's all it is. Thick film is basically for that reason. Thin film is basically to identify the species. Okay, so this is a standard hemorrhagical blood smear, how we usually prepare it, like with fixed with methanol, stained with Gemsa and stuff. It is usually a single sheet of intact red cells. So look for the percentage of red cells parasites among, for example, you see around 100 red cells, then how much percentage of that is infected. This is how you calculate, right? So the parasites per microliter can be calculated when the red cell count is known. Because the red cells are not destroyed and they look intact, the parasite and the red cell morphology can be examined easily. So this helps in identification of the species of Plasmodium. So we'll know whether we are handling the falciparum or the other non-falciparum malaria. Okay. So remember, thin film may fail to detect the parasitemia with a density below approximately around 1000 per microliter. But it's more useful than the thick film for counting very heavy infections. So this is a very tricky statement to tell, because in falciparum, the load of parasite is going to be extremely high. The density of parasite is going to be extremely high. But all these things is going to get sequestrized. Okay, it is not going to go to the spleen. It is not going to remain in the bloodstream as such. It's going to get held by the endothelial cells. It's going to get sequestrized. So the load is also very high. But when you take a sample, you might miss the parasite. So this is the thick one. This is the thin one. Okay, so can you see this kind of small dots here? So these are all the parasites. Okay. So in the thick one, it's usually a lysed thing. There are multiple layers. You're going to basically count how many parasites are there. But in thin smear, so you look at the RBC morphology is also well maintained. You will be able to look at the parasite morphology as well, and even the gametocyte morphology, which I showed you in the previous slides. So all these things can help you to understand whether this is falciparum or not.